Hi, good evening, everyone. My name is Marissa Benchea. I'm 43 years old, an adult living with cystic fibrosis, and I live in South Louisiana. I'm honored to be with you tonight. Thank you so much for joining us. Tonight, we're going to be talking through the top questions we've been receiving from the CF community around COVID-19. We'll be covering the trending questions around care and practical challenges, as well as questions about the current and future state of things. I know for me personally, I'm hitting the 2-month mark in isolation, and I'm definitely living day to day right now, but I'm also thinking about the future. So I am looking forward to speaking with Dr. Boyle and Karen Carey tonight. So as I said, Dr. Mike Boyle, President and CEO of the Cystic Fibrosis Foundation, will be joining us this evening, as well as Karen Carey, who is a Senior Case Manager with Compass, the Foundation's Patient Assistance Service. We'll then open up the floor and answer some of your questions live. And just a note, our speakers can't address personal situations or individual situations, so please try to phrase your questions so that they could be applicable to a broader situation and to the community. I want to thank Michelle Herpelsheimer and Rachel Cravens, who are in our chat tonight and moderating that. So hi, ladies, and thank you so much for being here and doing that for us. So with that, I would like to welcome Dr. Boyle. Hi, Dr. Boyle, and Karen Carey.
Hello, Marissa. It's good to be back together again.
Yes, it's good to see you, and good to see you both. So let's just jump right in. And I think we'll start off that first question with you, Dr. Boyle. I know we've been hearing about the CF community's experience with COVID-19. So could you share the latest with us? Because we know there's new information every day.
Absolutely. So I know I had a chance to share some of this during ResearchCon, but bottom line is that so far the experience with COVID-19 and CF has been overall encouraging. We've been collecting this data pretty carefully through the registry, as well as a physician board which has international groups that meets together every Friday morning to compare how things are going both in the United States and around the world. You might have also seen, Marissa, I think we talked about it a little bit, this Journal of Cystic Fibrosis publication that talked about 40 case reports from around the world, which gives some additional detail. And it also talked about overall things being pretty encouraging, but I can give you some specific numbers. So one of those things is that we know there's a little over 100 cases worldwide now of people with CF who have COVID-19, that 28 of those have been in the United States and are entered into our registry. Let's talk about the US cases. Of those 28 cases, 5 of those have been in kids, pediatric cases. 6 have occurred in people with advanced lung disease, and 4 of those are people who are post-lung transplant. That, again, the good news is that the majority of people have been able to stay at home. There's been few hospitalizations. There have been 2 deaths that we're aware of. One of these is an adult with CF. The other was somebody who was post-transplant. So, and I mentioned before that there have been reports, 2 in particular, of people who had very severe lung disease, lung function in the 20%, who had COVID-19 and fully recovered. So that's certainly encouraging. So overall, better than we originally feared, but still continuing to follow this closely. We need more data over time. The nice thing is the systems are in place for us to really be keeping track of this very closely.
Yeah, and it was nice to see that Journal of Cystic Fibrosis article a few weeks back, and the fact that we're already gathering this information. I know for me that's helpful to see. So you mentioned our post-transplant community. What has their experience been specifically, and what should they be keeping in mind right now?
No, it's a great call out, Marissa, that I think actually with lung transplant, post-lung transplant, the numbers suggest that we need to be extra careful. So we talked about 4 cases in lung transplant patients with CF and COVID-19. And those people haven't done as well. They've ended up in the hospital. There's been 1 death there. So this makes sense in some ways, unfortunately, because people post-transplant are on immunosuppression, right? And that may make the COVID harder to fight off. So I think that's a group that's particularly vulnerable. It's only a small group right now in terms of the numbers, but that's a group that really has at higher risk and has to be extra careful.
Okay, thank you. And then how has lung transplant, how is that being affected? Are people who need transplants still able to get them, and kind of what is the process with all that right now?
Yeah. So that's a great question. People may have seen that Dr. Joe Paluski from Pittsburgh actually put out a minute about this. I thought it was very informative because I know initially several of the lung transplant programs had actually gone a little bit on pause. But in general, transplant programs now remain open. That overall, the availability of organs has actually been less. There's fewer donors available because nobody's on the roads, which is probably the most common way that people end up as donors. That the good news is that there's been 4 people with CF in the last couple of weeks who've actually gotten transplants. That what has happened is the transplant programs have just developed very stringent protocols to be able to assure that their people who are undergoing transplant are protected from COVID-19. I think if that's a group that you're, for instance, you're awaiting a transplant, I would talk to your team to get your local story, but also realize that it may feel different. A lot of the hospitals are limiting the ability of family members to visit. And so that could affect sort of what your expectations are. So transplant looks different than it has just in terms of some of the numbers being a little slower, but it is still moving ahead. And for people that are waiting, there's still that possibility.
That is good to hear. I know those In a Minute videos, I watched that one around transplant, and those have been super helpful. So if people haven't seen those, they've been out on the foundation's social media, and they're just great, literally 60-second videos on things happening right now. So I highly recommend them. So kind of moving into this, for me, it's that what is going to happen as states are beginning to reopen? So we're seeing this in local areas and states. There are these phased rollouts, and I think a lot of us with CF, as our healthier peers are kind of all thinking about going back to kind of moving into their lives, we're thinking about that for ourselves. And I know there's been talk about needing to self-isolate until there's a vaccine. So do you feel people with CF need to do that and wait till there's a vaccine for us?
Well, now I think you're getting to the questions that I think are in everybody's mind. I was in clinic earlier this week, and by far it was the topic of conversation. I think part of that is because we're starting to see states open up, right, and use different approaches, and we're starting to think, okay, what's the future hold? That I think as a general principle, that people with CF and their families are going to be on a different timeline than the rest of the country. And we're going to have to expect to practice physical distancing and self-isolation for longer, but how long varies. And so let's talk about this a little bit. You talked about a vaccine. A vaccine would be a clear way to resolve this, right? But there are many other factors and things that can influence whether or not it's time to sort of re-engage and how much to self-isolate. So let's go through some of those. So one of those would be the availability of other effective treatments. Remdesivir actually looks like it has some effectiveness in more severe disease. It's being studied in more mild disease. If we developed a really effective therapy, obviously that would influence the timeline. Widespread testing, if we were able to develop a quick saliva test where you could actually make sure that if you were going to go somewhere that they had already tested and they didn't have it, that would really shorten timelines, obviously. I think the other thing is that there's going to be different prevalences in different parts of the community, different communities around the country, and that's going to influence and some of the consideration. And one of the things which we'll talk about, I want to make sure we talk about some point here is a little bit more about masks. That as N95s become more available to the general population, particularly people who are vulnerable, that might sort of change the ability to get out some. And we still have a lot to learn, but here's the key thing, which is probably what I would say is the key theme today, and that is up to now, a lot of the guidelines and the instructions have been very sort of black and white, cut and dried, which is stay home, no exposure, right? That I think increasingly what we're going to see is that we're going to stop talking about yes and no, and a little bit more about how we manage risk and assessing what's the risk for different situations, because the bottom line is there's probably not going to be one recommendation for CF that covers and fits every person with CF and their family. because there's lots of different stories, right? And lots of different, so one of these things is going to require a discussion with your own physician to say, what's my risk? What should my approach be? There's a couple of things which readily come to mind. I'll talk a little bit more about, just go a little longer because I think everybody is so focused on this. For starters, we're starting to see evidence that children in general are doing well, and that children with CF may do well. And so certainly people that have good lung function, who have some reserve, may take a different approach than somebody who's got very severe lung disease, or somebody obviously who's had a lung transplant. And so this is going to influence some of this timing for how to re-engage. That, I said I was in clinical earlier this week, and with every person I had this discussion, and every answer was a little bit different. There were some people that I said, hey, we can't mess around here. You really need to be isolated. There's somebody who's awaiting a lung transplant. We have to talk about how we're going to keep your family, as safe as possible, and how to do that. And there's some other groups who actually have very good lung function. Maybe they're younger, where they could potentially take a little more relaxed approach to this. So this is why I think we're going to have to start to get comfortable with not just cut and dry boundaries, starting to assess what's it mean, what's the risk for me, what's the risk for the things that I'm, what my family's doing, what I'd be potentially exposed to. This is a little bit hard, right? Because there's uncertainty here. It's very disruptive. It is worth it to be patient, though, to figure this out and to make sure that we're on the safe side. And I know that we've had so much experience as a CF community on being successful with physical distancing and making the right decisions for whatever is needed for our health. So I think we can overcome this challenge. We just have to realize it's going to require a little bit of maneuvering rather than black and white lines.
I appreciate you saying all that, and I think that's just comforting for me to hear. And I do think, like everything with CF is becoming personalized and specialized, and it's different for every person. So, I know for myself personally, kind of looking at those calculated risks and seeing what happens in my area. I wish it could be black and white, but I don't think it will be. So thanks for kind of covering those things. So as a thought on that,
about the personalized medicine, CF is becoming more and more personalized, and this fits right with it.
Yeah. So following up on that, with you mentioned kids, and I know a lot of people are out of school right now. So the first thing would be, should they go back to school for the rest of this school year? I know some states they're out completely, but there are other states that they're thinking about going back. And then do you think kids with CF should be able to return to school in the fall? And then I know we've got a lot of questions already coming in about college and kind of that, if you're going to be going off to college or going back to college.
Well, this is one I'm going to start by saying, make sure you talk to your own doctor, your own care team, right? But I'll tell you what my instinct is for this year, that I think there's a good chance that when you talk to your physician, that the answer is going to be to stay home for the remainder of this school term. And that's because what we're trying to do is to get more information about, exactly how people with CF are doing, to allow continued decrease in the prevalence of this. And so to me, you have to really be convinced that, over the next month or so that it's worthwhile to get back out. I think it's better to be conservative until we have more information about how kids are doing and those type of things. But in terms of the fall, I'm actually more hopeful for the fall, particularly for younger, healthier patients with CF, that this gets back to that personalized approach again, right? So that for younger, healthier patients, if the prevalence is down in your community, that there may be a discussion where it makes sense with your physician to do this. We're never going to change those things about trying to decrease the risk in terms of hand hygiene, and it'll be interesting to see as we head into the fall if people are wearing masks, those type of things. So I think there's a possibility for sure, particularly for younger, healthier people in the fall. The college ones, I think this is one you're going to have to have a real discussion with. Is there other ways that you can manage that risk? What's your own risk and vulnerability? Is it somebody who's already been pretty sick? That seems potentially risky to me. But we're also going to have a better feel as we get close to the fall of what's actually going on in different parts of the country, what's happened over the summer in terms of the prevalence. It's all those things which will contribute to really being deciding if it's wise for you, so the person, and for me, whatever the person has CF, if it makes sense for them to think about going back to school.
All right, thank you. So let's talk about what to do if a person with CF or a family member has to go to work and go back to work. I know a lot of people are working remotely, but some of these things aren't sustainable and some companies are going back. So how can they best protect themselves and their loved ones from COVID-19?
Yeah, this is question 1A, right? With the bigger one about what to expect and going back. But I think this is it has some similar theme in terms of assessing risk, and that the bottom line is this is real life, that there's no perfect answer to say there would be a way to do this with no risk if somebody in your family is going back to work. The approach that we're going to be taking more and more going forward again is this: how can we minimize risk? And that includes not only for people with CF, but for their family. And so first question would be, maybe it's already been asked, but can this family member work remotely? If they can, that'd be ideal, but that's not always possible, certainly. If a person is working and has to be there, then I would probably start to categorize those into high-risk jobs and lower-risk jobs. And then also think about, for the person with CF, who's the family member, are they particularly vulnerable? Do they have low lung function? Do they have lung transplant? And it's really the combination of those two factors which guide how strict to be, right? So I think the real thing that we want to avoid is that family members start to relax how careful they are as society starts to go back and starts to open up a little bit. That they absolutely, no matter what the situation is, have to be attentive to being smart about spacing as much as possible, hand hygiene. I think the other thing that always comes up is this question about clothes. I think in general, clothes, there's not a lot of evidence that clothes are something that causes transmission, particularly if you're at I should say, we're not so worried about clothes unless you're at a really high-risk job where you're actually at the front lines, a policeman, a healthcare worker. That's one where I'd say be extra careful about that. But so here's what I would say about for family members. If they're at a high-risk job, frontline, healthcare, police, persons at high risk, lung disease or transplant, really need to have a serious talk with your physician about strategies to continue isolation. That might mean isolation in the house. That might mean ways of trying to isolate. That's that high risk combo that's going to be worrisome. On the other hand, there's going to be some times where people have better lung function, are younger, their parent, their spouse is going to a job that is not considered to be high risk, that are already being very attentive to those. That's one where I think you're going to do all the typical things that you do to protect yourself, and that's going to be still a low risk situation.
Thank you. That's super helpful. And Karen, hi. It's so glad that we're going to chat with you now, kind of about some of you're here with Compass and the supporting role with Compass, which is so great. And I know I've used Compass before, so I'm so glad I can chat with you tonight and kind of learn more about what is there to support people and their families with CF. So can you talk a little bit about that employer piece where Dr. Boyle was just talking about that? What support is there for people with CF and their families to work with employers around going back to work?
Yeah, for sure. Thanks, Marissa. If Dr. Boyle's question was 1A, this is 1B, right? There are a lot of questions that Compass is getting around this sort of how-to, and it's absolutely an important conversation to have with your employer. We really hope you feel empowered to do so, to have that convo, to bring it up. Compass can provide you with a template letter that you can customize and make your own, so that you can make your own case for remote work to your employer if that's applicable to you. I'll also share that the CF Foundation is leading the effort to urge Congress to expand paid leave protections for people with CF and other at-risk groups who may need to stay home. Currently, only people with childcare needs impacted by the pandemic are eligible for paid family and medical leave, but the hope is that we can change that. And we really heard our charge on this from you all. Our work on this issue came as a direct result of hearing the needs of the CF community. When social distancing and stay-at-home orders started to come into play, Compass got, again, a lot of these calls about employment issues. And we heard a lot of concern about what this means for folks' ability to go back to work. You know, candidly, no member of the CF community should have to choose between their health and their livelihood. A few weeks ago, the foundation actually asked the community to take action on this issue. And as a result, thousands of CF advocates sent messages to their members of Congress urging them to expand paid family and medical leave. You know, and just sort of one more thing here, as states are beginning to reopen their economies, it's more important than ever that we keep that pressure on Congress to act. To do that, we're asking the community to share personal experiences. You know, if you've had a workplace leave issue during the pandemic and you feel comfortable sharing that experience, we are going to put a link in the chat where you can do just that. You know, I'd also encourage, actually, if you haven't checked it out, go to act.cff.org for more information about this particular action and others that you can take.
Thanks, Karen. That's super helpful. I know the advocacy alerts and being able to sign up for that and send a message to your congressional folks, it literally takes a minute. So it's super easy to do. So let's kind of move into some practical questions that people might be having around everything with COVID-19. And Karen, I would love to talk about the current challenges that people are facing right now with social distancing. And I know some are very hesitant to visit grocery stores and kind of this whole grocery piece. So we'd love to just talk about that for a second. And if you have any suggestions around kind of grocery store conversation and what people can do.
Yeah, I mean, you know, social distancing is causing us to re-examine so much of what we once thought was just routine. When it comes to getting groceries, there are a few options to keep in mind. So we've seen a number of grocery store chains suspend fees for completing an online order for pickup. Of course, food delivery is another option. And actually, Compass may even be able to connect you to a resource for financial assistance to help with the cost of food delivery. As one example, we know of a grant through the HealthWell Foundation. You know, and just as another option, in a handful of states, SNAP is actually conducting a pilot for online purchases with Amazon and Walmart. And you can go ahead and call Compass to find out if your state's involved in that pilot.
Great, thank you. That's really good to know. And HealthWell is a phenomenal grant program. And we're still talking about food. I know a lot of people and a lot of my friends were like, the whole takeout question has been, you know, I wasn't doing takeout for the first few weeks. I broke down because my kitchen can only handle so much cooking. Dr. Boyle, is it safe to get takeout and delivery? Let's talk about that for a second.
Well, we're coming up with a bunch of the questions, right? It's 1D maybe. That I think the bottom line here, again, it's a discussion about the levels of risk. That if you decided I want absolutely zero risk, sure, stay at home, do all your own cooking. I do think it's possible though are there ways to get takeout and delivery that are low risk? And a couple of things. You know, obviously it's better to have people deliver or to pick up if they have curbside rather than going in to get that. I think the thing that people always are concerned about is surfaces, right? And I think one of the things that's actually worthwhile remembering, early on there was a couple of reports and papers of being able to detect virus on cardboard for a couple of days, but I almost wish that hadn't come out, because there's a difference between being able to detect something by PCR, which is this incredibly sensitive way of looking, and actually having enough there to cause trouble, to cause disease. And that the overall risk from surfaces is pretty minimal. And then particularly if you let it sit out for a couple of hours, or if you do the wipe down, you don't touch your face, you do all the wipe down, the surfaces are going to be minimal risk. So in terms of order out, you can take those same type of approaches you do with groceries. You know, the delivery, the wipe down, leaving it out some. If you wanted to be extra careful, you could order some hot food, let it sit for a while, and then reheat it up again. Again, that's being really careful. So again, it's a discussion about relative risk, but I think that you can order. I probably wouldn't do it every day, but if you can order and have it be very low risk.
Thank you, that's helpful. And then what extra precautions should people be taking right now? And I know that you mentioned masks a bit earlier, so I'd love to hear a little bit about especially this mask piece with precautions.
Yes. Well, so in terms of extra precautions, I mean, I have to say at the beginning that we keep doing what the CF community has been doing for a long time, right? And what we're really good at, the hand hygiene, the staying 6 feet apart, staying home as much as possible to avoid others who are sick. Your mask questions actually, I think, is worth some further discussion. That, again, we divide masks in some ways into those that protect the person wearing them and those that protect others. And that the face coverings, which would be any cloth mask, in general, has much more of the protect others. If someone's sick, it prevents the person from coughing and spreading in an area. So it's been clear from research that that helps prevent some of the spread or decrease the risk of spread. It's really only the N95 mask which truly protects you. Some of the cloth masks and other things do provide some protection, but it's at a much, much lower level. So really it's the N95 that protect the person who's wearing them. That right now, because of shortage, N95s are going to medical workers and people at the front lines. And this is important because they're being exposed. They're directly in the line of fire. We need to keep them healthy, right? And but I do think that there's going to be a time in the future that once all the work that's going on to produce these masks and equipment starts to catch up a little bit, that the idea that people in vulnerable populations, people with CF will be in that, will start to wear N95 masks in public, we'll start to see that, and it'll be encouraged. I think the thing that's been slowing us on that right now is because we want to make sure that we're not taking them away from people who are in the hospital. We know we're being exposed. So that's one of the things I think is stay tuned to. We'll continue to see how that develops as a supply. So that's one additional precaution to think about. The other one that I would just say is there's a certain amount of work just in terms of mental health and mental wellness that we're going to need to do as this drags on. And I just want to encourage people to be willing to go outside and take a walk. And this again gets back to, as long as you can make sure that you're not going to be in a crowd, that you can do this in a way that you can identify people coming towards you and you can keep 6 or 8 feet away from them. There's a fear that I've heard in multiple people of just going outside the door. And unless you're in New York City, like my daughter, that it's a very good chance that you can find a spot to get outside at an odd time of day even, where there's no other people around. That's entirely healthy to do. There's little, if any, risk of doing that, and it's certainly going to be great for mental health and wellness.
Great. I'm actually glad you mentioned that because I know we've had some questions around that. And Karen, I want to shift the conversation to you and some access questions. The next few questions talking about if people are having trouble with food costs, and then we'll cover some other things in this section as well. So can you talk to us about some things around if people are struggling with their food costs?
Yeah, Marissa, I'm really grateful that you brought this question up, because I'll tell you, Compass has gotten a lot of calls about just the skyrocketing costs of food. To start, eligibility for state food assistance and nutrition benefits can vary really depending on where you are. But if you're wondering whether or not you qualify for programs like SNAP or WIC, maybe you've even tried in the past, the circumstances are different now. It's worth looking into. Many people are also turning to local food pantries now. And again, if utilizing services offered by your local food pantry isn't something that you've done in the past or even thought about, know that a lot of people are doing so in this unusual time. It's one possibility for really stretching that food budget. And keep in mind that Compass can help you locate a food pantry in your area, or if you need food more immediately, call 211 or even the USDA National Hunger Hotline. Those are two examples of resources that you can turn to right now as well. And just for a second, to circle back to that idea or that question about social distancing and concerns there, I'll add that a lot of food pantries are offering drive-through services now, where volunteers will actually put food bags into your car. You can call ahead to find out what procedures are in place if you have some concerns there. And last but certainly not least, if you've got school-age kids, many schools are offering to-go meals, and some locations are actually opening up their summer meal sites early. So again, something to work into as a possible resource that you may already have access to.
Great. And then can you talk to us about resources regarding rent and bills and how to afford other basics?
Yeah, well, I mean, certainly in the era of coronavirus, we know that many people who never had financial challenges in the past may be having them now. While it's important to remember that Compass doesn't provide the direct financial assistance, our team of case managers is dedicated to making a connection to referrals that may be able to help directly. And these referrals can vary on a lot of different factors. Again, location is one, their eligibility criteria, resources, current funding. We've seen organizations pop up across the country with specific COVID-19 funds to help with the additional burdens and financial strain that this pandemic is causing. Just to share a few examples, we've found additional resources for, again, living expenses, new food resources. There are even often industry-specific resources. So as an example, resources or funds that are established for folks in the service industry. And Marissa, I'll add just quickly that there are a few steps that we as individuals can take as well. Things to do to try to be proactive. We've seen utility companies put shutoffs on hold. We've seen landlords put evictions on hold. Some banks and credit card companies are offering waived fees, maybe even waived payments during the pandemic. And as the bills keep coming in, feel empowered to call your gas company, call your credit card company, explain the situation, and other types of vendors like this to try to stay ahead of things.
Great. It's super helpful. Thank you. And then kind of focusing in on people who have unfortunately lost their jobs, could you talk about resources available for them around filing for unemployment?
Yeah, so, numbers surrounding unemployment are staggering. Numbers don't even begin to tell a full story. So, if you have found yourself suddenly in these uncharted waters due to a job loss, I want to start by saying you're not alone. Compass has gotten a lot of calls again about this exact topic. And while case managers can't file unemployment on your behalf, we'll work to connect you with work accommodation or other legal experts who can answer your questions.
And then kind of talking then about that piece around insurance. So if you lost your job and you're looking for new insurance, would love to hear a little bit more about resources. And I know Compass does a ton around this, so I'd love to hear about that. Yeah,
absolutely. I mean, we know exactly how critical coverage is for people living with CF. It's important for you to know that a special enrollment period can be triggered for those who involuntarily lose employer-based coverage. There are guidelines on cff.org to help you understand your coverage options and choose a plan, and outline some key considerations for you when you're making this decision. So things like costs, specific benefits, and also access. But know that you can also call Compass, and a case manager can have that personal in-depth conversation with you to really help you assess what options are available. Picking an insurance plan can be very daunting, and we know it's such a heavily weighted decision that's so important for everyday life. So you can call Compass and know that we can quickly help assess your options.
Wonderful, thank you. And I know we'll probably pop that Compass number. I think it's 844-COMPASS. Which
You're right.
And we can pop that into the chat as well. So thank you for speaking about those few different critical things for people in their lives. I know we want to keep a lot of time for questions, so we've gotten a ton in, so we're going to go through 2 more questions here. So, and then we'll jump over to the Q&A. So Dr. Boyle, I'd like to shift over to this kind of care center piece. And I know for a lot of folks who are, for myself, just that 3-month appointment was just supposed to happen. So we're just so used to relying on our care teams and seeing them. So how should we be working with our care teams right now? Dr. Boyle, you're muted.
There we go. Sorry about that. I'm happy to answer that question. Although first I want to say, Karen, your voice is so comforting. I may have to call Compass just to listen to you talk. It's great. So I think, Marissa, your question was about how to work with our care teams, particularly right now. And you're right that they're under a lot of pressure, right? So the vast majority of the CF teams are also involved with COVID care. And so they're pulled in a lot of different directions. It may mean that you have to realize that the interactions could be a little bit different. That obviously telehealth, right? Everything's focused on telehealth. We've had some really great telehealth visits in my own experience. We've included the whole team, but every team's gonna be a little different depending on how much they're getting pulled to cover for COVID and what's going on in their community. So I know how committed those teams are. I would say be a little bit patient, get back to them, realize that it may be talking to a nurse, it's gonna be telehealth. So it'll look a little different, but we've heard nothing but amazing stories about the commitment that teams have been showing to making sure their patients still get really good care.
Great to hear. But then also from my perspective, just selfishly, I would love to know, and this is also for people who have children with CF, how can we best maintain and monitor our lung function right now if we're not seeing our care teams? I'd love to hear a little bit more about that.
Right, especially because we're used to seeing each other in clinic, right, and getting PFTs and how we. So the first thing I would say is just make sure that people still are paying attention to their daily treatment regimens, right? Not to get sloppy on those, because that's a key time to be staying well. Certainly, Trikafta has been very helpful in this in terms of helping people stay well. That, as we mentioned, teams are using telehealth to keep up with people. So, continue to do that. That the one thing I'm excited to share about is we realize that one of the things that we usually use in clinic is spirometry to help assess how someone's doing with their lung function. And so after discussing this, we actually decided as a foundation that we wanted to step into this to be able to help make telehealth not only a call, but something where you could have some measurements. So we actually have signed 3 different contracts with the intent of providing all people with CF in the United States in the next several months handheld spirometers that they can use at home, and to be able to work with their telehealth visits, and something they'll continue to have going forward. I'll warn you that we would love to be able to send everybody a spirometer tomorrow, but there's not enough made. We were able to get 2,500 spirometers. We've actually given those to the centers. They're going to start giving those to patients who have the most needs in this. Somebody who maybe they're trying to decide if they're going to bring into the hospital, somebody who's been struggling. Anyway, we're going to start letting the centers identify who those people are. But I can tell you that over the upcoming months, as soon as they can produce them, we're going to start trying to allow everybody sort of over the age of 6 with CF to have their own handheld spirometer that would send out directly to your house for free. So we'll continue to expand this, keep you posted on that. And I think, Marissa, to answer your question, if a combination of telehealth, combination of continuing your own regimens, some of these other ways, such as the handheld spirometers, I think we can actually do a pretty good job of monitoring health.
Thank you. That's super helpful to hear. We're going to move into our Q&A portion since we've received so many questions. Thanks so much. And now let's just use the rest of this time together to answer all the community questions. I'm going to kick it off, though, with one for Dr. Boyle around research and how is CF research being affected?
Okay, we'll try to go fast so we can get lots of questions. How about that? I think the bottom line is that there's a couple of key trials which are still going, but overall there has been some slowing. So I think the biggest one everybody asks about is the Trikafta 6 to 11 study. Is that slowed down? Because people are interested in getting that Trikafta moved down. The good news is that study's fully enrolled. We still anticipate that would wrap up this year, which would give a chance for that data to be submitted to the FDA. PROMISE study, which is a study about how Trikafta affects all the parts of the body, is actually fully enrolled and going. The studies which require new enrollments are really many times on pause. We've been working with sites to try to be able to help pick this up as soon as we can, but truth is there are going to be some of these studies which are going to be slowed down.
Thank you. For one of the first ones we got in, Dr. Boyle, what is the hospital treatment protocol for a COVID-19 infected person with CF? Is it different than other patients with advanced lung disease?
So I think there's probably two things to that. I think the first question is on the CF side. Almost everybody, if you read that Journal of Cystic Fibrosis article, if you're sick enough to be in the hospital, you are going to likely be on IV antibiotics. Because we always say, is this caused more by the bacteria that's there, or is this caused by the COVID-19? So that might be a little bit different, because most people that don't have CF don't get antibiotics for Pseudomonas, right? They wouldn't do that. So that'll be the typical CF exacerbation treatment that you would likely receive. At the same time, remdesivir, which is this new antiviral, has been approved for anybody who is in the hospital whose lung oxygen is below 94% saturation. So that would be standard for everybody, but really the regimen would look like your typical exacerbation treatment with the addition of remdesivir if your oxygen is low enough. That's probably what we have right now. We're hoping for additional therapies moving forward, and there's many trials which are going on which will help inform that.
Okay, thank you. We'd love for you to address, Dr. Boyle, the risk of a second wave. So it is difficult to get a clear understanding of this and the degree of hazard when it comes to coming out of isolation. I'm sorry for reading these questions, and then I'm probably going to go close my shade because I feel like light is coming out on me. So can you address the risk of a second wave?
Sure, and I might also address the second infection, because that's originally what I thought you were going to ask. I think everybody wants to know, okay, what's the likelihood that this is going to suddenly re-explode again as we go back into society? And this is going to depend a lot on us, right? If society actually goes back and returns to what we were doing before, then absolutely there's going to be trouble. But if we learn some lessons and say, guess what? We're going to have to limit some of the big meetings. Even when people are together, they're going to have to stay socially distant. They're going to have to do hand sanitizers. We're going to need to wear masks to help control this. Then my hope would be that we could keep that rate at a level that would slowly decline. I don't think this is going to disappear overnight. We know that's not the case. What we'd like to do would be a slow, steady decrease. Now, whether or not this would reemerge in the fall because of weather, we don't know that. The other thing I think that sort of goes with this, people have been asking about, is can you get a second infection? And here's the bottom line with that, is that there's a lot of confusing data right now. Certainly there have been people who have had COVID-19, been tested negative, and then shortly thereafter are positive again. And what's unclear, does that mean they had a reinfection, or was it that they actually had a longer version of their infection that wasn't detected for a while? The one thing that we haven't seen is somebody getting really sick twice. We haven't somebody being admitted or on a ventilator, recovered, and then have that happen to them again. So we think there's at least some protective effect. I would caution us right now about using the antibody tests. They're not very, we don't know how protective they are, and right now they're not very accurate. They're working on that part. So I would say stay tuned. The main thing we can do is to continue to learn our lessons, and that'll help prevent this from being another wave in the fall.
I know for me, and I know a lot of people are thinking about this. So this next question, again for Dr. Boyle, is your recommendations regarding travel this summer, specifically taking an airplane to see family or them taking an airplane to see someone with CF.
Yeah, well, this gets back to that risk discussion, right? And I have to say that right now, it would not be advisable to get cooped up on a plane with a bunch of people who you don't know where they've been, what they've been doing, what their background is. So this is going to end up being something we're going to have to continue to assess. I would be cautious right now until we start to see what happens as society starts to open back up. That includes as well people who are coming to see you, or coming to see a person with CF, that we want to be learning from what's going on before we're affected by it. So it may be that later on in the summer, we see that there's actually some decrease and that people are really being good with protection, that you start saying, okay, well, I've got good lung function, a younger person, this makes sense for me. I think that there's going to be a while for the higher risk groups to really say that traveling, particularly by planes, is going to be a good idea until it's clear that this is starting to get better.
Okay. Karen, jumping back to you, we had somebody ask about insurance covering home spirometers for telemedicine. Would love to hear a little bit more about that.
Yeah, I'd say that for starters, it's really going to depend on your plan. So if you've got questions and want help doing a benefit verification, give Compass a call and we can kind of navigate those waters for you. And ultimately, if there isn't coverage, if we can get you connected to resources for any sort of uncovered service, that's our goal too.
Okay, thank you. Also, another one for you, Karen. We'd love to hear about if we cannot go back to work because of COVID, what should we do about getting health insurance?
So we're in this area where some states have actually opened up a special enrollment period due to the pandemic. Again, you can call Compass and we can help you figure out whether or not your state is one of those. You can also go to healthcare.gov to get pointed into the right place or check out your state exchange. Helping you again look into a public option if that's available to you. That's something that Compass can help with. If you've got options for COBRA, looking at kind of everything that's on offer, we can help you assess those options there.
At 844 Compass.
Thanks for doing my plug for me. Yeah.
So, Dr. Boyle, this actually really I'm interested in the answer to this one because of my own family situation. What are your thoughts on hanging out with extended family, siblings and their children, parents? What are your thoughts on bringing them back into your bubble?
Back into your what?
Bubble, like where I'm in my bubble.
Your bubble, yes. Well, so the same principles we've been talking about all along come down to this. So I would start by saying, okay, what's my risk on this? If this is something where I have particularly low lung function, then you want to be extra careful. So in terms of bringing back into the bubble, there's different ways of doing that, right? So it may be that you say, okay, we're going to actually get together outside. We're going to sit in the front porch, the backyard, whatever it is, the driveway. We're going to keep some spacing that I think if you're able to maintain that spacing, then we want to encourage some of that because that's going to be good for health. If it really means actually bringing somebody in and they're actually going to be sharing a bedroom and something like that, that's something you have to be really thoughtful about. What's the exposures that they've had? What's their risk? What have they been doing? Have they been isolating, self-isolating, and they haven't been out? Then probably things are okay. If they've been out and about, then you may actually want to think about, okay, we want to do something where they're not out and about for a period of time, a week or so, to make sure there's no issues. It's one of the reasons why we'd love to have some quick testing. This is going to require some assessment, though, and think about, okay, if we want to do this, what's their risk? What's my risk? What can we do to minimize that risk in terms of spacing? And then you'll find that personalized approach, which is the right fit for you.
Thank you. Speaking of testing, we've had a lot of questions about antibody tests. Did people with CF get them? Will care centers have them?
I'll take that one. So I mentioned that right now the antibody tests, there was a lot of enthusiasm initially because here's the thinking was, oh, if we do antibody tests and we show that people already have this, that means that they can go do anything, right? They're bulletproof. And that the idea would be that we could eventually sort of develop some herd immunity. That is, more and more people that have antibodies, maybe people who got sick and didn't have any symptoms, that would help protect us. We'd still love to be in that situation, but there's a couple of cautions. One is that the antibody studies, we're not entirely clear of what the implications of having antibodies are right now, whether or not that's completely protective. That's something that's being studied. The other thing is there was a lot of variability in the results of those antibody tests, so that they're being reworked and trying to be standardized. So right now there's not going to be a whole bunch of antibody testing for people. I think once we're confident about what antibodies mean and that we can measure them accurately, it could be a great tool. The one problem with antibodies is it takes a while to to be able to detect those. That's not a quick test. It requires longer. The one that everybody would love to have, in which there's been at least some work on, would be an antigen test. That is identifying something within saliva, for instance, that isn't an antibody, but actually detects presence of the virus. That allows sometimes for quick tests. It's what you get with a strep test when you go to the doctors and you get that. That would allow us to actually be very quick in reviewing those, and that would probably be even more powerful until we're able to really figure out the whole antibody story.
Okay, that's helpful to hear. Thank you. Karen, for you, when employers expect employees to go back to work, I think this is a really important question. Are there any protections for people with CF?
Well, I'll say that the tool that Compass has in our toolbox right now is the template letter that I mentioned previously. And it is the idea that with the help of your provider, you can try to make a case to your employer for the special accommodations that you need. Again, there are some workplace and other legal expert resources that we can connect you to, like the Job Accommodations Network is one example. Even the American Bar Association does have some additional resources around this idea of workplace accommodations. So the sort of short answer to the longer answer I just provided is that we can try to get you connected to that right resource to, again, help make your case, because it might not be a possibility for everybody.
Great, thank you. And then Dr. Boyle, is there a reason the CF experience with COVID-19, 28 cases, 2 deaths, is different than the general population?
Well, it's a good question. I mean, I think I would divide up CF and lung transplant, right? Because I think lung transplant, we know that's trouble. So let's focus on people with CF and COVID-19 and how we've been pleasantly surprised. I think when this first started, there was a fear that this might be, gasoline in a match, right? That anybody who got COVID-19 with CF was going to get really sick, and that hasn't been the case. So what are the reasons potentially for that? I think one of the things is just that the absolute numbers are maybe lower than we expected because people with CF are so good already at knowing how to keep 6 feet away, avoiding people who are sick, right? And from the very beginning, they said, oh, I gotta start doing this. And so that actually helped. That made a big difference. For people who have COVID-19, the fact that they're not as sick, we don't know for sure. We're actually sponsoring some research looking at CF cells and COVID-19 to see if there's anything different scientifically. I think I mentioned at a previous time that there is a little bit of evidence that people with CF don't have as dramatic immune response to infection in their lungs. Otherwise, they would be more sick all the time because of the Pseudomonas there. And it may be that the big reaction that many people have to COVID-19, which causes them to be on a ventilator very quickly, the people with CF may not have that. So that doesn't mean don't be careful. I just think if there was one silver lining to this, it may be that people with CF won't have some of the immune problem, which is causing a lot of people to get very sick from COVID-19.
Okay. You just mentioned there, and I know if you can briefly touch on this because we are closing in on time, about that you all were talking about around funding. Is the foundation allocating any funding towards COVID-19 research? Because I know you just said in the last answer kind of that y'all are looking at that.
Well, so I think one of the things we had a long discussion about is whether or not that we were going to try to fund working on a cure for COVID-19 or a vaccine or something like that. And it became very clear that there are giant companies and tons of money that's already flowing to this, and that we weren't going to be able to accelerate that. So we said, well, what are the things that we can really lean in on that will make a difference specifically to help people with CF? So a couple of things came to mind. I did mention, we said, can we support research? So we've actually talked to Tony Fauci and to Francis Collins, offering them our cell lines. We probably have the world's best collection of lung cell lines. And when most COVID research right now actually doesn't occur in lung cells, it occurs in kidney cells, which is a little funny, but we've offered our lung cell lines from our lab that they could use to really test this. We're actually going to be testing specifically in CF. Are there differences with COVID-19? But really the areas that we decided to lean in on is the telehealth part. We felt like that was something that was specific for people with CF, providing spirometers, helping teams be able to do telehealth. And that we'll look for opportunities if something comes up, but we feel like there was already the best scientists in the world having as much funding as they needed to work on the vaccine part. So we focused more on the CF specific part.
That's very interesting. One quick last question before we wrap up. Dr. Boyle, what lung function do you consider well enough to be more relaxed?
That's a good.
It's a good one. It's a little bit tricky though. Love to know.
Yeah, it is, and it's like anything else. It's not an off and on. I think, I will tell you what we usually do when we think about lung function. We think about FEV1, right? And we think of people whose lung function is below 40% as being severe. So that's a group that I would be nervous about and be extra careful with. That 40 to 75% range is a group that's more moderate. And so I still think that group's going to be careful, but there might be some opportunities, particularly for low risk. And again, assessing what that means and what the situation is. And group that's probably going to be the one that's able to lead the charge for people with CF as once this happens is going to be people who are younger, people whose lung function is maybe 80% and above. They have some reserve there in case they were to get sick, and we've been seeing that in general, people have been doing okay. So those are probably the general guidelines. A less than 40, extra careful. That 40 to 75, 80 range would be an in-between, and then above 80 might be the group that we say, oh, this is a group that has some potential, particularly if they're younger.
That's very helpful. Thank you. So we're wrapping it up. Thank you, Karen and Mike. And Karen, I would love for you to kick this off. We've covered a lot of questions today, a lot. And what reflections do you have for the audience and everyone listening tonight as we move forward together? So I'll start with you, Karen.
I might steal a colleague's phrase here about shared humanity. And if there's one thing, it's sort of this idea that we're definitely in this together. I can tell you I can't express enough gratitude for the caller who giggles when my kids add an ambient soundtrack to our calls, and offer a generous, it's okay. But again, it's this idea that we're all in it together, and Compass is here for you in a corner where the Wi-Fi is fastest of our homes, but we're here for you. So again, it's that 844 Compass number, and we're in it together.
Thank you, Karen. Dr. Boyle?
Sure. Well, maybe two closing things come to mind. I think the first one is just what we've already been talking about, and I could feel it really in clinic this week is, up to now we've been in this situation where it was basically the answer was no, right? The answer was stay home, don't do anything. We have to really clamp down. Now what we're going to be seeing in these upcoming month or two that different states and different communities are going to be starting to open up, and the discussion is starting to swing a little bit more to how can I, what's right for me? How can I move forward with minimal risk, right? How can I keep those risks as low as possible, but realizing that the long-term solution, other than for people who maybe are particularly vulnerable, is not just going to be always no and period. And so this is going to require some real discussions with your doctor, with your care team, assessing where you are, assessing who the people you're interacting with and what the things they're doing. So it's more complicated, right? And it feels a little bit less clear about the guidance, but I think that's where we're headed into. And it's going to require, at the foundation, we're going to continue to provide the best guidance we can. This is going to be changing as we see what's happening in the community, as prevalence changes. Obviously, as the availability of some of the protective equipment becomes more widespread. So just realize that there's a little bit of a shift here, but it still is thinking about what's the right thing for me, given all those factors. And just the second part, though, is that I know we can do this, right? We've overcome many challenges over the years and come up with these incredible achievements, treating 90% of people with CF. The list is long. Medicine looks at people with CF and the CF community for, the leadership in this. And so this is an opportunity for us to once again show how good we are at this as we start to maneuver going forward.
Well, thank you both so much. This ends our time together tonight. Thank you, Dr. Boyle and Karen Carey, for speaking with us. And thank you to our chat moderators, Michelle Herpelsheimer and Rachel Cravens. Thank you for everyone who joined and all your amazing questions. And a recording of tonight's event will be posted on YouTube for those that missed it. And anyone that attended or registered for the event will receive an email tomorrow with a link to that recording. The email will also include more information about Compass and available resources. So thank you again for joining. Be well and stay safe.